All right, good evening, everybody. Thank you for joining us this evening for our public hearing for the CDBG-CV public hearing for a grant application. And we will explain what that acronym stands for just in a second. But I would like to introduce to you all Claire Bouchard. She is our Housing Stability Program Manager. Is that correct, Claire?
That's right. Thank you, Michelle.
You're welcome. Claire is going to basically run us through what's going on, why we're here tonight, also a summary of the grant, a few other things, and we will have time for questions at the end if anyone wants to ask questions about the grant application that Larimer County is applying for. But with that, I'll give you, we are on a Zoom webinar platform tonight. So what that means is you can see us, but we can't see you. So the way that you interact this evening is by using the Q&A box you find down below, or you can raise your hand and we can let you speak that way. So feel free, as we give a presentation this evening, feel free to put your questions in the Q&A box and we can answer those at the end. Really quickly before Claire starts, I do want to share my screen so you guys can see the agenda. Give me just a second. Claire, can you see the agenda?
I sure can.
Wonderful. So we have already done our welcome and our introduction. Next on our list, Claire will go through the purpose of the hearing, the grant summary. She'll also talk about COVID and homelessness and how that really relates to the grant. Then we'll do some questions, comments, if there are any from folks participating. And then Claire will talk about next steps and we will go along our merry way. So with that, Claire, I am going to stop sharing my screen. And you are more than welcome to take over.
Well, thank you, Michelle. Thank you all for watching and participating in our webinar tonight. As Michelle said, I'm Claire Bouchard and I'm the Housing Stability Program Manager. And what that means is the county has a program with the federal government called Emergency Rent Assistance that I'm managing, and also some work in our homelessness prevention and our eviction prevention work. So tonight we're talking about some homelessness work and people experiencing homelessness and COVID. So when we put that all together, as you might imagine, if you're experiencing homelessness and there's COVID around you or you've been exposed to COVID, there's really nowhere for you to go and isolate and quarantine and recover. And so this grant is really addressing that. The county is working with our partners at the Health District of Northern Colorado to secure funding to house people experiencing homelessness, as well as some participants of our community correction program, if they test positive for COVID, to be in an isolation, recovery, and quarantine center. So this is non-congregate shelter versus congregate shelter. Some people might be familiar with Catholic Charities or the Rescue Mission in Fort Collins. That is considered congregate shelter. This isolation, recovery, and quarantine center is a standalone building with individual rooms and bathrooms that people get to isolate in with their own bathroom and bedroom. So it's more healthy, it's safer, it keeps other guests at the congregate shelters healthy because they're not being reintroduced to COVID. And the people experiencing homelessness or community correction participants have a place that's safe for them to get better and move on with their life. So the grant that we're applying for is through the Colorado Department of Local Affairs, and it's their Community Development Block Grant COVID or coronavirus grant program. This is a standalone grant program. The state has several CDBG grants throughout the year, throughout the state, but this is a special one to address COVID impacts. And so the application responses have to do a lot with why is this happening now? What are we doing to prevent, protect people and then respond to COVID? And what programs and services will do that work in Larimer County? So our grant application is to both what requirement to tell people about it. That's part of the application, not only answering questions from the state, but also sharing it with our community. We want you in the community to understand what we're doing. And if anyone has questions about our unmet housing needs, especially those needs of low to moderate income persons, we welcome those this evening, as well as community solutions that maybe we haven't thought to explore if people have feedback on those questions. So this is the first time the county has applied for CDBG-CV funds. They are usually distributed to municipalities as community development block grants. In this round, the coronavirus specific impacts can be addressed, like I said earlier. This grant application is for 2 months of non-congregate shelter that can house up to 24 people at a time who are experiencing homelessness, who again are participants in our community corrections that are testing positive for COVID-19. The payments, we're asking for $93,000 roughly, and those funds will go towards staffing the center, meals for the participants and guests, transportation, security, rent of the facility, and other medical supplies. We're partnering again with the health department, who will also be part of the shelter experience. The Catholic Charities, the Fort Collins Rescue Mission, Family Housing Network, Salvation Army, Homeward Alliance, the Community Corrections, all of those agencies will be making referrals to the isolation, recovery, and quarantine site. Then I guess I'll just move into my last little section, which is about COVID and homelessness. So like we were saying earlier, congregate sheltering is not healthy during a pandemic. There's no place to separate or recover in privacy with warmth and cleanliness. There's nowhere to wash your hands or shut a door. Non-congregate shelter is the best place to recover. It's also very underfunded or not funded in our region by the partners. Our partners at FEMA, the Federal Emergency Response Agency, can help pay for the first 4 months of service, so from December through March of 2022. But we need to seek funding for those final 2 months of April and May of 2022. Just to give people an example of where we are with COVID cases in the people experiencing homelessness population, we had 40 people test positive in October for COVID, and the community is sheltering sick guests in hotels, and it's expensive and it's not sustainable. So what we really need to do is secure this non-congregate shelter with our partners at the health district for referrals from community corrections and our shelter providers. And then just to give people another example, in April of 2020 through May of 2021, we had a similar isolation center open, and we had about 220 people recovering in that center. At this time, Michelle, I'll turn it back to you.
Thanks, Claire. Just a couple questions. With this facility, how many folks can be housed there? You said they have individual rooms, is that correct?
I believe so, yes. So it's 20 to 24 people at a time, and we have we'll have a staff person and security on site. So if people have more medical issues or questions about their recovery, there's somebody on staff to talk to. They're not just by themselves. We'll also have a nurse care manager on site that can do some preventative troubleshooting things.
Oh, wonderful. And you said that they were staying in hotels, or that's currently where we're housing folks that don't have somewhere else to stay. How many on average do you think we're housing a month? Because we don't.
Yeah, so we housed almost 40 in October and part of November of 2021. So they would come and go. They are allowed to stay in a hotel for about 10 days during their symptom testing period. But after that, they have to go back to a facility or provider that can help them with other permanent housing solutions.
So it's while they're in isolation or quarantine period.
That's right. Just like we would if you have a home and you're diagnosed with COVID, you stay home for 10 days. This is a period of time that also applies to our vulnerable population.
Wonderful. And then last question, you mentioned community corrections a couple times. Do you want to just give a very high overview? What is that? If someone doesn't know what community corrections is, what is community corrections?
Well, correct me if I'm wrong, but it's kind of our pre-jail situation. So folks that have maybe need to do some correction of their behavior based on a fine or a sentence through the judicial system, they, if they're not that serious offenses, they get to stay in a dorm-like setting during the week, and they get to go to work during the day, but they have to check back into the community correction center at night. And again, it's like a dorm or congregate shelter situation. So if folks are exposed to COVID and test positive for it, they're risking other people's livelihood and health by staying there. There's no real place for them to shelter or isolate. And so they too have unhoused needs.
Perfect. Yes, that's Sorry to put you on the spot there. I should have probably just explained it, but you did a very good job. And sometimes people go into community corrections from state prison system too.
Oh, okay, great.
Transition into the community because oftentimes they don't have anywhere to go right after they've served their time. And so community corrections is a program that helps them find jobs, gives them some place to stay stable, and actually gives them some treatment options too, because often they're not getting treatment in prison. So it's a great program that Larimer County is able to provide to our community.
That's wonderful. Yeah, the discharging out of a system is a really big problem in communities.
So it's great that we are looking for a place so folks aren't, when they're needing to isolate, they're not in with the rest of the individuals in that program as well.
Mm-hmm.
I don't have any other questions. It doesn't look like we have any other questions coming in. So can you tell me what the next steps are?
Yes, thanks, Michelle. So this application, the CDBG-CV grant application for the Isolation Recovery and Quarantine Center for 2 months of operations is due December 8th. We will post the application submission document online about that date too. So if people are watching this and want to read more about the submission and the responses that we sent in, they're welcome to do that. The Department of Local Affairs at the state will review applications in December and January, and hopefully we'll find out in January if we have those funds available. If we don't get the funds, we're really going to try to keep the IRQ open through March, and then we'll have to look at other community partners or funding streams for the months of April and May. It also depends on the community's COVID levels and our cases and our spreading and hospital capacity. Again, this center not only helps people recover safely and healthy, we're trying to keep people out of our overburdened hospital and medical center capacity. We're trying to lessen that burden. So we'll have to look at case numbers and see if we really do need funding for those last 2 months if we don't get it now, and just make some decisions during that time. And then if we do get the funds, we need to send announcements out to the public. We'll hold another public meeting and we'll ask for the community's feedback on how the non-congregate shelter is performing and working. And we'll be sure to include people that want to participate in the future or have interest in this project.
Great. So if people have questions, either prior to the applicant submission or afterwards, where can they find more information?
Well, right now they can email me at cbouchard@larimer.org, and that's CBOUCHARD@larimer.org. We'll also be posting it on our website, likely larimer.org/ERAP or ERAP. That's for our emergency rent assistance program, but I think we'll have a link to this as our programs around housing stability are quite small right now at the county, and we don't have a full built out web presence, but we'll make sure we point people to that.
Perfect. So really all they really need to do is email you, and you can probably provide them the information. Yes. And we might have it on the website here in a few days about the time the application is submitted.
Yes. Thank you. Mm-hmm.
You're welcome. Well, Claire, it looks like we've maybe covered everything. Is there anything else you need to add?
No, thank you so much for everyone's interest in this important work. It's something we didn't think we'd have to do again. We again held the IRQ open in April of 2020 through May of 2021. And we were hoping that our community was getting vaccinated and staying safe. But of course, there's breakthrough cases and people continue to spread the virus. So we have to take care of people that don't have houses.
Yes, thank you so much, Claire, for taking your time tonight. And thank you for anybody who is watching this for your engagement and your dedication to our community. And with that, we will wish you a good evening, good morning, good day, depending on when you're watching. And hopefully we'll get to meet in the future. Thanks, Claire.
Goodbye.